Repeat hospital stays in Pennsylvania costing millions. This was a recent newspaper article in our local newspaper giving us data from the Pennsylvania Healthcare Cost Containment Council on 2009 readmission rates within 30 days. Congestive heart failure, otherwise known as CHF, had the highest readmission rates for 2009. Hospital governing bodies, not just in Pennsylvania but across the United States, have created standardized discharge instructions for CHF patients to try to cut down on these readmissions. My name is Joanne Graham, and I'm going to go over those specific teaching points for CHF patients in my presentation today. The first area of teaching for CHF patients are about their medications. Now, CHF causes the heart to pump inefficiently, and therefore the kidneys retain salt and water. So two of the most common medications that the CHF patient may take, number one is furosemide or Lasix, and that's a diuretic which will help get rid of that excess fluid in the tissues. To strengthen the pumping action of the heart, one of the common cardiac drugs is Corade. So what we need to remember about these medications is the patient needs to take them at the same time of the day and take the dose that's prescribed by their physician. Don't take an extra dose of Lasix because you have a little more swelling and you think you need to take an extra dose. You check with your physician first. So the most important thing to remember about the medications is to take the medication at the same time every day with the correct dosage. The second area of teaching to the CHF patient we're going to go over is the diet. Now, I said the kidneys retain salt and water, so of course we want a low salt sodium diet. First thing I would do is take the salt shaker off of your table. You don't want to salt your already prepared food. You want to be very careful how much salt you're adding to your food during the cooking process. Some of the foods that are very high in salt that you want to look out for are canned soups. If you're going to eat a canned soup, the light soups have about half the sodium that the regular soup has, so that would be a better choice. These prepared dinners, very high in sodium, you want to watch out for those. Frozen dinners, especially ones with prepared sauces, very high in sodium. You want to be careful with those also. Lunch meat, also high in sodium. I know these are quick meals, quick fix meals, but you want to try to eat more fresh fruit and vegetables. The next area of teaching is weight monitoring. The patient wants to weigh themselves daily so that they can gauge how much fluid that they're gaining in a 24-hour period. The most important thing is to get a scale that is accurate. Try to get a digital scale so that you can weigh yourself to the 1/10 of a pound. That gives you a more accurate weight gain or loss in a 24-hour period. You want to make sure that you weigh yourself at the same time every day with the same amount of clothing on with the same scale. So a good practice is to get up in the morning, go to the bathroom, empty your bladder, get rid of the excess fluid in your bladder, and then hop up onto the scale. Now, if you have a weight gain of probably 2 to 3 pounds in a 24-hour period, you want to just consult your physician just to make sure that that's okay with him, that he doesn't think it's too much. He may ask you what you've eaten the day before and just kind of figure out why you've had that weight gain, and he may adjust your meds for you. The next area of teaching for the CHF patient is to make them more aware of the worsening symptoms of CHF. So you're going to go over those: an increased weakness or fatigue, new onset or an increase of shortness of breath during regular daily activities, a need for more pillows at night because of difficulty breathing, swelling of the feet, legs, or stomach, often noticed when your clothes are fitting too tightly, restlessness or confusion, unexplained rapid weight gain, approximately 2 to 5 pounds or more in a week when your eating habits haven't changed at all, and a loss of appetite. Sometimes when you have all this swelling, it'll just make you feel full, and then you have a loss of appetite. Other areas that the nurse may go over with the CHF patient before they leave the hospital are about physical activities. And that's individualized. It depends on what their activity level was prior to coming into the hospital. So that'll be taught to them according to their ability. The other area is follow-up care, and that's just tells them to keep their doctor's appointments so that the doctor's reiterating all these points that we go over with them in the hospital. And we're hoping that by teaching the patient, and the goal is to make them more aware and educated of the signs and symptoms so that they can call the physician earlier, so that they can seek help before it gets to a point to where they're going to have a hospital stay.